So this is my presentation on the staph infection, and for the main definition, it's an infection caused by bacteria located on the skin or nose, mainly caused by Staphylococcus. The causes and risk factors. So starting off with the causes, picking at pimples or scabs, having contact with a staph infection on somebody else, and then high exposure to like the bacteria that causes it, and then sharing hygiene products like razors, towels, and stuff like that. And then exposure to contaminated surfaces, which could probably be stuff like at a gym or at a martial arts area. And then risk factors, it's mainly like surgery, dialysis, breathing tubes, feeding tubes, needle use, chronic illnesses like diabetes and autoimmune disease, and then weak immune systems, and then contact sports like football or martial arts. The anatomy of the disease, it's for the staph infection, it can infect like pretty much any part of the body, but it usually only stays on the skin, but it can spread to other parts if left untreated. As for like what it does, it basically just causes like skin irritation that worsens if you don't treat it. For the signs and symptoms, the signs would be skin infections, bone infections, endocarditis, food poisoning, pneumonia, and toxic shock syndrome. And for the symptoms, red bumps on skin, swollen red skin, sores, blisters, sore swollen eyelids, and it would all be painful. As for the treatments, there are three main ways to treat staph infections. The first of which being antibiotics, with penicillin being used for it most oftenly, and then wound drainage / cleaning. So like doctors would create an incision and drain any fluid and then just clean it out. And then removal of like medical devices. So that would mean catheters, feeding tubes, stuff like that could have had bacteria on it and then transported onto the inside of the body that could be causing the staph infection. And that's the end of the presentation.